Hello, I'm Ashish Patel.
And I'm Fred Trucker.
In this episode, we will be talking about and reviewing some of the newest released data from the CDC that measures the COVID impact nationally. There are a few slides in a PDF that's part of the daily release, specifically the time series slides. A little bit about our organization. We are healthcare data journalists working at CareSet Journal. We primarily focus in on Medicare claims data and Medicare insights, but in the context of this video, we'll be focusing on, again, the information released by HHS and CDC and ASPR, and that looks at the entire US population from the perspective of cases, labs, death data, and hospital admissions. There's a lot more information about this data and other government data, public data assets released by CDC and HHS in an FAQ that we've co-developed as a collaborative project with several different organizations here on the slide in front of you. So we'd like to thank everyone, give you a shout out here. So you can, if you're a data journalist, you can find detailed information about aspects of the data, the raw data underneath it, and other data assets that can help you inform your readership and communities around the country. As we go through this material, you may see some positive signs about the fight against COVID. They are not indications that we should all get into big gatherings. Please do continue to follow CDC recommendations. You can see, yes, we are wearing our masks, we are maintaining social distance, and we hope that you continue to do the same.
So when we look at the report that's just been released, again, the purpose of the report overall is to be the dashboard that has been used for several months inside the federal government to make critical decisions. And so there's two versions of it. There's a PDF version and an Excel version, and both the PDF and Excel versions have slightly different information. And one of the most powerful things that we have in the PDF version, that you could theoretically get pictures of this inside from the Excel version, but they've kind of really give us some really nice data visualizations here about time series. However, when you try to read these time series, it's pretty important that you really read these carefully to understand what they're doing, because it's a dashboard, they really are packing a lot of information, and they do that by shifting the meaning of the scales as they go through the slides, and even on one slide. So for instance, the slide at the top is new cases, and right over my shoulder is new deaths, and on the bottom right over Shish's shoulder is new hospital admissions. Those are totals. And so would you mind scrolling up just a little bit so you can see the one over my shoulder just a little bit better? If you want to see the first surge when COVID first came into the country and the healthcare system was not prepared, that's that thing that's really right over there that Ashish is circling with the mouse there. If you scroll up a little bit, it's kind of interesting to look at that same time period in the cases where we had the flat cases. That is probably due to two factors. One is the case reporting systems were probably not mature, so there's a lot of people who are getting COVID and just dealing with it at home and not necessarily telling some public health officials. So the reporting data pipeline probably wasn't there. The other thing is the healthcare system didn't necessarily understand how to handle COVID cases. We've gotten a lot better at the COVID treatment, so it's also possible that more cases were ending in mortality. But obviously this is kind of the first thing that you can see here. And then when you look at the bottom right, you see that when you're thinking about hospital admissions data, that pipeline was immature so substantially that they actually just blocked it out on the left and said, we're not going to talk about it. The top right is about the lab test positivity, and the history of the lab test positivity. And one of the other things is that in general, there's only PCR lab testing. It's not all the types of lab testing, and especially not at-home testing, which is just coming out now and will be more common. By the way, this is the 2020 December 17th data picture that we're looking at, based on the very first day it was released, which is December 18th. As we get more information, for instance, it'll become more important that right now this is PCR only testing. There's going to be several more types of testing down the pipeline. When testing first came out, we remember there was a testing crisis, like where are we going to get all these tests? And what that means is that you were only giving tests to people who were really profoundly symptomatic, and as a result, a huge percentage of them were coming back positive. But part of the reason why that number is so high is that the total testing rate was very, very low. And so as you're moving to the right over that time series on the total number of cases, the total number of testing being done is going up. Mm-hmm. So that's really important. Let's go ahead and shift to the next slide real quick. And now what we're going to do is we're going to look by census region. And in a second, We'll talk more about these lines down here, but you see the key is blue is northwest, purple is midwest, I think south is green, and then west is orange, and then national I think is gray. First thing you can see, again, over my shoulder, you remember when people were talking about, COVID in New York, and at the beginning it was really hitting New York hard and the Northeast hard?
Yep.
Well, that's exactly what we see. But the other thing to really mark here is that this whole chart, except again for the test positivity, which is kind of the top right chart is in its own world. This is now a rate, a per capita rate, which means the number here is how many people per 100,000. So this is the new death rate, the new case rate, which is a very different picture than the total, right?
Yep.
So, and so again, you're seeing that there was a very strong regional effect at the very beginning in the Northeast, probably centered around New York. And then there's a blip here. To be perfectly honest, I have no idea what that means. And then if you look towards the end here, you start to see purple writing, and that is this kind of it's the Midwest kind of getting hit really hard by COVID, and where it stopped being a kind of big city problem and started to be a more rural problem. All that's happening, kind of as we speak.
Also translating into the hospital admissions above me.
Yeah, exactly.
This is the Midwest.
Now what you see is that Midwest really being hit hard by the hospitalizations in the latest. You see those really spiking up. The other thing is, if you scroll down so you can just see the top, when you're talking about new cases in general, the cases precede mortality. I think when somebody you think about it, you think of it as testing comes first. Testing is a pre-intervention. Then there's the number of cases that you get, and then there's the number of people who die. So when you see a spike in cases, they will be followed by a spike in mortality. And you can kind of see that happening here in these maps, where you start to see in the early November, you start to see spikes, and now you start to see spikes in death in December as a result of those spikes in November, right? So it's a little bit of a lag, but they are predictive of each other. And so, these are the primary time series. Let me talk briefly about the lab positivity. This is a total change. So when you're talking about the top right up here, way above Ashisha's head, now you're talking about the regional test positivity rate, roughly equivalent to what was on the slide before, but you are also talking about the number of tests. So you're seeing both the issue of total tests being overlaid with the test positivity rate, and you see what I was saying about that effect, where more tests over time actually decreases the rate of positivity, which is a good thing. You want to keep those positivity test lows, because what that means is that the intervention of having people go isolate is being effective. Would you scroll up again just real quick? And one of the things that you see, I think probably the best in the new deaths, but you also see a little bit in the hospital admissions. I'm going to scroll up just so it's not right behind me. You see how that there's a jagged edge inside all there? That jagged edge is a weekly pattern. And it looks like a weekend pattern, but it's not. And of course, I was corrected on this by Alexis over at the COVID Tracking Project. It's actually a Sunday-Monday effect, which is to say that there's dramatically less of these events on Sundays and Mondays. And it boils down to a reporting defect, because it's not the number of people that died on that day, it's the number of people that were reported as dead that day. So the people who are dying over the weekend, basically, the reporting lags over into Monday and Tuesday, and as a result of that, it looks like there's less deaths over the weekend. That's not actually true. It's just a reporting artifact.
I think that's really the reason why, if you look at that, there's a blue line that's here, and it is the 7-day moving average.
Yeah, that 7-day average blue line really is probably the best story that you're saying, and so that's it.
I think one of the key things here on the slide that shows you the regional effects is to understand what states are make up each of these regions. So if we could throw on the screen for a moment the states that make up Northeast, Midwest, South, and the West, just so you get a better understanding of what geography you might fall into, and how this and future editions of the daily reporting are generated.
Yeah, and of course, obviously, you can see how much New York City would dominate the Northeast here. It's a really small region, landmass wise, the other 3 regions.
Yep.
So I think that's a huge part of the story. And I think it's interesting that this is the only time they use this regional breakup. In other places, they tend to use the FEMA regions, which is another map that we'll show in different videos.
Yep.
So, so this is really interesting. I mean, it's a good example of in general, the value of this data release, the value of this community profile report coming out, is that we can now see on the outside the decisions and the tools to make the decisions that are made by the federal government. There's been great dashboards by the COVID Tracking Project and others to take a look at what's happening on the outside when we gather all the data together. The federal government gathers all that data too, and that's where the decisions are made. And again, the other thing that I think is really the takeaway from this video and all of the ones to follow is this COVID stuff is real. We should be following the CDC recommendations. It's really, really important that not to blow off those recommendations because they really, really do have an impact. And there's been multiple studies on these data sets that indicate when the rules are followed that there's positive impact. And it also indicates when the rules are not followed, there's disastrous impacts. So again, COVID is real. Please protect yourselves and your family by listening to the CDC carefully and follow those rules as hopefully we resolve the pandemic by coming together and using the mask and doing the social distancing and doing all the other things. And again, I think one big message is, and I think we're going to do this, is hey, use Zoom for Christmas dinner. It's a great time to share the holidays with a family across the screen.
It is a safe, effective treatment for the pandemic.
Yeah.
That's a good point. Thank you very much for your time.